Dr. Darren Schmidt at the Nutritional Healing Center of Ann Arbor, and I talk about healthcare the way Mother Nature intended. This video is about 4 different success stories related to an autoimmune condition of the thyroid. So I'm going to read one to you right now, straight off my laptop here. I'm looking at the screen. It says, this is from a patient who's been with me for several months now, and she's had several positive autoimmune tests and chronic sinus infections for 30 plus years. Now I just have to give you a statement, and it doesn't matter to you, but it matters to my board, that I do not treat infections. She's had vast improvement in many painful symptoms, and that she was due to have labs redrawn prior to seeing her rheumatologist for follow-up in July. So early this week at the follow-up appointment, I'm reading this right to you, my doctor revealed that my autoimmune panels are now negative. I knew I was feeling much better, but hearing that was just astounding. He asked me if I had been using the prescription he gave me, and I told him that I had not, as I did not want to begin a life of living on tons of medication. So instead I consulted with Dr. Schmidt for guidance in healing these issues through nutrition. His response was, "Whatever he is having you do, it is working, so keep at it." Now that's a great statement, and I'm glad that doctor said that to her. And there are some doctors who say, stop doing this program because you don't know what's in those supplements, they may kill you. And I've heard doctors will say that sometimes. But what every single doctor needs to say, and they never do, is, what is Dr. Schmidt doing? I need to do it. So these medical doctors need to apply what I'm doing in their practice with diet and supplements, but they never, not once in over 20 years, have reached out to me to find out what I'm doing so that they can learn it and apply it to their patients. I just want to make sure these results and my many thanks and good news go to Dr. Schmidt. I want to explain to you another patient who's been with me now for maybe 6 months, and her weight keeps creeping up, and she's on the exact perfect right diet. And her protein intake is high, her carbs are low, and her fat intake is low too. She should be losing weight, but she wasn't. And I got to the point where I said, look, you got to run some lab tests. So I had her run some thyroid tests, and she has an autoimmune condition. Her immune system is attacking her thyroid. So I put her on a product called artemisinin. Now in the past, I've had 2 other people have good results with artemisinin for their autoimmune situation. And what is artemisinin? It comes from a plant called wormwood. And in 2015, for the first time ever, a plant got the Nobel Prize in medicine. So there were multiple researchers that were researching wormwood / artemisia. Artemisia is the active ingredient in wormwood. And the Nobel Prize in medicine went to that type of research for multiple researchers. So I've used this for several people now for their autoimmune issues. And this patient then started, within 1 week of starting artemisinin, and that's an herb from MediHerb. It's a product from MediHerb. Within 1 week, her energy was up, and now she's down 6 pounds, and she's losing inches. She's measuring the different dimensions, standard measurements, and she's losing inches around her thighs, her waist, her chest, etc. So her diet's been the same now for many months. It's just that her immune system was overwhelmed with something harming her thyroid and other parts of her body. And artemisinin is knocking that down, and now she's able to lose weight. Here's a third person with great results regarding their thyroid situation. And this is a girl in her late teens. The graph goes all the way back to 2016. Now she had her thyroid removed, and this graph is thyroglobulin antibody. This means that her immune system is attacking her thyroid. And her mom and I started talking right at this stage right here last year, and she went on the ketogenic diet, low carb, and you can see this thyroglobulin antibody drop down. Now she didn't start taking supplements until much later. So the majority of this decrease, or maybe possibly all of it, is from just the diet alone. So now this, in the medical doctor's eyes, was cancer. And they are completely baffled by this. They have no idea what's going on. They've never seen this before in their whole career, that somebody with this high thyroglobulin antibody, and she doesn't have a thyroid, and so they just called it cancer. They've never seen this reverse ever. So another success. This is absolutely phenomenal. The last and fourth case study I want to go over is regarding a woman that's been with me since 2016. And she has a high TPO antibody. TPO stands for thyroid peroxidase. It just simply means the thyroid's being assaulted by the immune system, and there's other factors, and we need to solve it. So in 2016, I put her on some supplements and a program to try to help her out. And her score for the TPO was 207. We want that to be below 9. So in 2017, she retested and it was 254. So I missed it. I was not successful with that first program. So I changed it up. And this is when I put her on artemisinin, the supplement that I explained earlier. And then at her next test, which was December of 2017, her score was now 184. So now we're on the right track. It's headed down. And then in July of 2018, it was 111. In December of 2018, it was 79. So we're getting good results here. I changed her program. I thought she was done with artemisinin. I put her on some other things. And then in June of 2019, her score went from 79 up to 141. So it doubled. And so what we're doing now is I put her back on artemisinin, and we'll just keep monitoring. And this is a multi-year process. And she may be on artemisinin now for, 3 more years, 5 more years? I don't know. But we can monitor with the lab test. So at some point when her TPO is below 9, then maybe she can try to get off of it, but maybe she needs to be on it for the rest of her life. So we'll just have to see how it goes. So now, again, I need to say don't treat autoimmune disease. That's a legal statement. At the federal level in the United States, I provide nutrition and herbs and dietary changes to improve the structure and function of the body. So the structure function statement is a legal federal determination based on profession. In the medical field, they don't talk about structure function. But in the holistic healthcare world, we have to. That's our thing. Because that's Mother Nature. That's how the body, that's how you communicate to the body is with, hey, how are you functioning? And how's your structure? Do we need to fix something? Whereas in medicine, they're looking at the symptoms and they're looking at lab work. They're not necessarily looking at physiology and try to fix abnormal physiology and try to make it normal physiology. So structure function. Let me show you, on my wall in my previous videos, I talk about, let me move this a little bit. So follow the physiology. That's function. How do the cells work? That's how you fix physiology. And I got a couple other posters here. Here we have malfunction of physiology. And then here we have correcting malfunction of physiology with the red font. Okay, so there you go. That's structure function. So if you have a holistic healthcare practitioner and they try to shun any discussion about disease and symptom, that's why. And if you have a medical doctor and you're talking to that person about structure function and they don't want to talk about that, you have to know what the different professions will speak about. So people ask me all the time about drugs, and they say, I don't talk about drugs. Let's talk about regaining the function of your body. We'll use nutrition and supplements for that. And then when you go to the medical doctor and you say, hey, I got this symptom, they give you a drug, and you go, but why did I get this symptom in the first place? They don't care about that. That's not their field. They're just going to address the disease. They're going to address the symptom. So I hope that helps you understand the relationship between the standard medical practitioners versus holistic alternative healthcare practitioners and the language between the two. So if you like this information, please give me a thumbs up, share and subscribe, and I'll see you at the next video.